Hello, and welcome to Lung Cancer Initiative's presentation on infection, disease, and prevention for cancer survivors. Before we start, disclaimer, all material presented through the presentation and through additional resources are strictly educational. Information presented should not be a substitute of medical advice from a practicing doctor or other medical professional. Talk to your doctor or healthcare provider before pursuing different treatment, prevention, and other lifestyle changes. So, before we dive deep into this topic, get some background information and some background terminology here. So throughout this presentation, I'll be talking about various terms and various words, and this is just a brief overview of that. Starting off with cells. You'll hear me mention this multiple times, but cells are simply the tiniest forms of life. They can either live on their own or be the building block of other living things. Just know that you and everyone else is made up of multiple different types of cells. Now, microbe is another way to say cell, but microbe is usually used when referring to disease-causing cells, also called microbes, and there are many different types of microbes. When talking about infectious diseases, these are any form of illness, sickness, or disease that is caused by another organism. Unlike chronic diseases, such as cancer, diabetes, and the likes, infectious disease can be spread or transmitted. The terms such as infectious microbe, infectious agent, and infectious organism are all interchangeable and mean the same thing. So now that you have some background, let's get some background on you and your body, starting with your immune system. So your immune system is broken up into two parts. You have your innate and your adaptive. But let's start with your innate. So the innate system is the body's first line of defense against any and all disease. It consists of two parts, the first line and the second line. The first line is your skin and mucus. Your skin acts as a natural glove to protect your organs from harmful microbes. The mucus that lines your nose, throat, and other internal organs act as a trap in which microbes can get caught in and be stopped from spreading further into your body. The second line of defense, that is also in your innate system, consists of disease-fighting cells and microbes. These cells are sent out by your body when a harmful foreign organism gets past your first line of defense and is detected within your body. The cells can engulf, destroy, and even kill these harmful microbes. Your adaptive, also known as third line of defense, is another part of your immune system. The adaptive immune system is your body's most powerful and complex immune system. Many doctors and professionals spend years just studying the adaptive system just to figure out how it works. This system is activated when your second line of defense is not enough to stop disease from spreading within your body. This system is specialized and must be primed or turned on, meaning that your body must come into contact with an infectious agent before the adaptive system can fire it off. When your body comes into contact with a new foreign organism, it generates immune cells to specifically combat that specific foreign microbe. When these cells are made, the body makes copies of them to store for later use, giving your immune system a sort of memory for that infection. This is why when you first get sick or infected from a disease, it usually results in a worse sickness than if you get infected with the same disease a second or third time. This mechanism is similar to how vaccines work. So for instance, in the beginning of the year, if you get infected with the flu, you may become very sick. You may have a high fever, lots of symptoms, and you may be stuck in bed for a long time, unable to do anything. However, a couple months later, you may get infected with the flu again, the same strain of flu, and you may notice that you don't feel as sick. You may get a little fever, a little runny nose, a little cough, but you're all right. And that's because your adaptive immune system remembered the first time that you were infected and used the copies of those immune cells to fight off the flu virus when you got it a second time. So let's talk about these specific immune cells. Specifically, let's talk about your white and your T cells and B cells. So starting with your T and B cells. So these cells are specific immune cells that originate from your bone marrow. Both T and B cells start off as lymphocytes or white blood cells, a type of white blood cell, and they later mature in the thymus, which is located around the bottom of your throat, and become T cells. Or they stay in the bone and mature there and become B cells. Both of these cells can make unique receptors on their cell surface to attach and kill specific microbes. These cells are then sent to specific spots in your body, such as your lymph nodes, spleen, and tonsils, common sites which diseases are caught, transported to, and killed. Your T and B cells can also be transported around your body to help fight off infections. So with your white blood cells, these cells belong to your innate immune system, or your second line of defense. White blood cells come in many different forms, and each is different. Each different form has its own function. For simplicity, though, we will be referring to all of them as white blood cells, and for your knowledge, know that white blood cells fight off many different types of foreign microbes. Unlike T and B cells, which are adaptive and must be primed before fighting off a specific agent, white blood cells target any foreign material in your body. Different types of white blood cells will target different types of foreign agents, but they do not need to be primed, and thus they do not have a memory. So now that you have this background on how your body works and what's going on inside your body, let's talk about the specific medication you're taking and how that impacts your body. So, as you know, as a cancer patient or survivor, you have to take multiple different types of treatments. But we're going to talk about two main treatment forms: chemotherapy, or chemo, and radiation. So, let's start with chemotherapy. So, as you know, chemotherapy is an umbrella term for any medication that uses specialized chemicals to treat a disease. Um, Specifically, chemotherapy works by disturbing a specific function of a cell, preventing it from duplicating or replicating. Chemomedication is nonspecific and is made to target fast-growing or replicating cells and not just cancer cells. Because the drug will target any fast-growing cells, like cancer, the drug will also affect other fast-growing cells, such as your hair follicles, your stomach lining, and your blood and immune cells. This is important because your blood is one of the key elements to your immunity. With radiation is a form of energy used to kill off cells by disrupting their cell cycle and reproduction. Doses of radiations, usually in a specific region, is used to kill off these cancer cells. Now, radiation of any form is a great way to kill off cells of all types, and this can make it dangerous on its own, but in a supervised and controlled manner, such as radiation therapy, radiation works great to kill cancer cells. Unfortunately, though, because radiation is just a form of energy, it does not dictate which cells it kills, and thus healthy cells can also be endangered. This is why when getting an X-ray form of radiation, you're given a lead jacket or a cover to wear to protect healthy cells, as radiation cannot pass through lead. But how does this medication specifically impact your body, though? Well, as I said before, both these types of medication are non-specific, and they'll target any type of fast-growing cells. Cancer cells are fast-growing, and so the easiest way to kill them is by telling the medication to just simply target any fast-growing cell. But that comes with the added risk of it targeting hair, skin, stomach lining cells, as well as your immune and blood cells. Now, your blood with it targeting your blood cell, that's really important and really bad because it lowers your blood cell count, right? Red and white blood cells. With reduced blood cell counts can lead to iron deficiency, lower oxygen level, and most important, lower immune cells. White blood cells, one of the main immune cells, can have lower rates. With lowered rates, your immune system will not be as strong to fight off harmful diseases. So when you have a lower rate of immune cells, there's a specific term we used, and that's called immunocompromised or immunocompromisation. So the National Cancer Institute defines this as having a weakened immune system. People who are immunocompromised have a reduced ability to fight infection and other diseases. This may be caused by certain diseases and treatments such as anti-cancer drugs, radiation therapy, and other treatments. So now you know how your body is working, how your medication is working, and how those two components interact with each other. Basically, what you need to know is that your medication can in turn cause you to have less immune cells, which can cause you to become immunocompromised, and immunocompromisation can lead to a higher risk for infectious diseases. So, now that you know all this, let's talk about what these infectious diseases are. We're going to cover three main types of infectious diseases to keep it simple. We're going to talk about bacterial, viral, and some other non-commons. So bacterial diseases are going to be things like E. coli, TB, tetanus, pneumonia, strep, and salmonella. As you can see, some of these, such as E. coli, salmonella, you can get through ingestion. With viral, those are going to be your diseases such as influenza, also known as the flu. COVID is a viral disease, HPV, as well as measles, mumps, and rubella. For other non-commons, these include fungal, protozoal, and parasitic diseases, such as mold and mildew, which is a fungal disease, as well as worms and malaria, which are parasitic diseases. So how are these diseases transmitted? How do you get these diseases? Well, there's five main ways that they can be transmitted to you: direct contact, indirect contact, vector, air, or ingestion. So with direct contact, this is a form of contact that involve directly touching an infected individual. This can be done by shaking one's hand, hugging, kissing, and coming into direct contact with an infected site, such as a scrape, cut, or lesion that the infected person has. With indirect contact, this form of transmission comes from touching surfaces that have been contaminated by an infected individual, touching objects that have been coughed on, sneezed, or sometimes even sweat on. This usually happens when an infected person touches an object before properly washing their hands, and then the object is then touched again by an unsuspecting person. If that secondary person touches an open part of the body, say their eyes, their mouth, or other form of opening, before washing their hands, their hand that has become in contact with that infectious agent can then infect them through that bodily opening. For vectors, these are transmissions which come from organisms that carry known diseases, such as mosquitoes, ticks, and fleas. Being bitten or sometimes even accidentally ingesting one of these can result in infection. However, it is important to know that not every organism in a group of vectors carries disease. Let's say in a swarm of mosquitoes or flies, maybe only a handful of them actually carry disease. But it only takes one bite from that organism to cause an infection. Air, so this form of transmission comes from air droplets from sneezing, coughing, as well as from lingering microbes in the air that are sometimes present from an infected individual breathing, coughing, or sneezing in that location. Say if someone is sick and they're in a room, they cough, they sneeze, parvovirus or bacterial particles comes out of their body and stays in the air. Someone else can walk into that room right after them, breathe that air, and get infected that way because the virus particles or other disease particles enter into their airway through that. Ingestion, which also includes the form of drinking water. So the most common form of this transmission comes from foodborne disease and contaminated water. Foodborne diseases are common, but can be easily prevented from proper food hygiene. Waterborne diseases are usually caused by ingestion from an untreated water, such as lake, ocean, and often river water. Fortunately, in the United States, city water possesses a low risk of waterborne disease, as all city water must be treated and pass state and federal guidelines. Private water, such as wells, can pose a risk to contamination, and if you have well water, you should be regularly checking it according to local or state guidelines. So all these transmissions are always there and will always be a present aspect in anyone's life, but it's nothing to fear as there are many, many ways to prevent them. And in fact, there are two common forms of prevention when it comes to infectious disease. We have common practices and we have specific prevention practices, which are usually only in place in places where there's high infection rates or as recently when there was a pandemic or epidemics. But let's talk about common practices first. Of the few forms of common practices, there's hand washing, cleaning, disinfecting, which there is a difference between the two, regular hygiene practices, and nutrition. So with hand washing, This is, of course, properly washing your hands using soap and water for for about um, for about a minute to a minute and 30 seconds. However, when washing your hands, you want to avoid antibacterial soap um, because scientific studies have proven that there is no significant difference between using regular and antibacterial soap. However, it has been proven that these soaps can kill good bacteria, increase antibiotic resistant bacteria, which are harder to kill and cause serious disease, and they can even harm your endocrine system, and they're also harmful to the environment. So, in all, antibacterial soaps just don't have the benefits needed. So instead of antibacterial soap, you want to use regular liquid soap and optionally apply hand sanitizer afterwards if you feel it's needed. When it comes to cleaning, this can involve simple actions such as dusting off countertops, vacuuming, mopping, and other cleaning practices. You'll be surprised at how common cleaning practices can affect your personal hygiene and also prevent disease. Disinfecting is actively using disinfecting solutions, which are commonly available in most stores, to clean objects and surfaces. This could be as simple as using disinfectant wipes to clean your tables and doorknobs, to using disinfecting laundry detergent. However, you want to make sure to check product descriptions, as not all products labeled as disinfecting are efficient. Also, when using a disinfectant, read through the instructions properly, as many require specific instructions. Some disinfectant sprays and solution will require you to clean off the area first, spray it down, and leave it for a while, or do some type of specific application process to make sure you kill off any microbes. For just simple hygiene practices, this goes to things as washing your food and practicing proper food hygiene, which is, things like not cross-contaminating your meats with your veggies or your fruits. And this can significantly reduce your chances of sickness, not just from foodborne illnesses, but other common illnesses that occur with bad food hygiene. Other practices such as dental and body hygiene are also great everyday measures to reduce infection. A clean body is a healthy body. With nutrition, a proper diet can greatly strengthen an immune system that has been weakened by medication. Taking in the proper nutrients helps naturally strengthen your body and is beneficial to your overall health. Talk to your doctor or nurse about potentially implementing a licensed nutritionist into your care plan. So now let's go into some specific prevention. So we're going to talk about four main specific preventions, starting with PPE, or personal protective equipment. So PPE can consist of different objects, such as masks. These can be cloth, medical, N95, you may have heard, as well as face shields. However, it's important to note that N95s are more effective than regular medical and are far more effective than simple cloth masks. Though cloth masks can be used when you don't have a regular mask available, note that many microbes and many smaller viral particles can easily pass through the linen of cloth. When wearing PPE and considering PPE, it's important to consider why it is important. Many times I like to use this specific analogy. When you're in a car, you have a seatbelt, but that doesn't mean that your car no longer has a brake. Just because the seatbelt is there to protect you doesn't mean you have to take the brake away to stop you from getting into a car accident. Same thing can be applied with PPE. Yes, you may have other preventive measures taking place. You may have the appropriate vaccinations and you may have proper hygiene and all that. But just adding this extra layer is just going to increase your prevention and it's just going to help you become less susceptible. Speaking of vaccinations, the next more specific prevention is immunizations. Ask your doctor for an updated list of shots and boosters, and stay up to date with all seasonal shots, such as flu and other shots. If COVID ever becomes a seasonal shot, which it may very well, you also want to stay up to date to that. However, one important thing to know is as cancer patients, you want to be wary of the shots that you are taking. Specific shots, such as live vaccines, may not be suitable for cancer patients. You want to talk with your doctor before getting immunizations. Inform the individual who is giving your shot, if they are not your doctor, about your conditions, medications, any specific instructions or protocol your doctor has given you, so that you can remain healthy and you can remain safe when getting immunized. Another thing you wanna practice is proper hygiene that we already talked about before. But the third special prevention is bug spray, and you're probably thinking that's just a very specific form of prevention. But you have to remember, vector-borne transmission is very common, especially in places that are very hot and humid, such as North Carolina. With bug sprays, there are many different bug sprays and they have different strengths. So make sure you read the product description and buy the proper spray for you. Also, it's a good idea to read the ingredients to make sure that none of the ingredients used in the bug spray may have harmful negative implications on yourself. Some other specialized items that you might want to consider, such as wearing bug spray, is maybe drinking filtered or bottled water, especially if you have well water, or water that is not always properly treated. It may also be beneficial to invest in items that will help you reduce your risk of infection. Things such as using a soft bristle toothbrush to reduce gum irritation and cuts, using duller knives to reduce cuts, wearing unscented lotion to keep your skin from becoming dry, which will also increase your risk for cuts and skin irritation, as well as wearing proper gardening gloves and long sleeve clothes when gardening, or really the proper clothing when doing any sort of outdoor or recreational activity. So there's all these prevention steps, and you can take all of them, but life happens, and sometimes we end up getting sick, and that's okay. Um, we have specific we have specific steps and action that you can take if you get sick or if something happens to you. So starting off with an illness. What happens if you become ill? What should you do? Well, the first thing you want to do is contact your healthcare provider. Let them know what's going on, what type of sickness you have, the symptoms you have. Speaking of your symptoms, you also want to monitor your symptoms. You want to take your temperature readings if you have a fever, if you're feeling hot. You want to take notes of worsening or easing of symptoms. If your symptoms are getting worse as your illness progresses, it may be a sign that your illness is getting worse. You also want to take the appropriate medications to alleviate any discomfort from the symptoms. And whether that medication is prescribed or over the counter, you want to make sure you follow through the instructions for that medication all the way through. And you also want to take care of your body using proper hydration, drinking lots of fluid, lots of healthy fluids, and also taking in proper nutrition. But what about physical wounds? Physical wounds are a common way for infections to get in and for infections to happen. So, what should you do if you have a physical wound, such as cuts, scrapes, or large open injuries? Well, the first thing you want to do is disinfect the site. You want to wash, clean, and disinfect the wounds as soon as possible. For disinfecting, you want to use rubbing alcohol and proper ointments to treat the site. Then you also want to cover and protect the site. Use proper band-aids and or gauze to cover the area to prevent further debris from getting in. Um, then you also want to monitor the site or the wound. Periodically monitor the site of the wound for swelling, redness, or warmth to the touch. These could be signs of an infection, and you should contact your doctor immediately if these signs get worse. Then you also want to clean the wound periodically. Wash, clean, and disinfect the site at least once or twice a day, and reapply a fresh band-aid or gauze to cover the site. Repeat this until the wound is fully healed or a scab comes over. If a scab does come, do not irritate the scab. Do not pick, scratch, or remove the scab, as this is your body's natural healing process, and tampering with the scabs can lead to re-injury or increase the risk of infection. However, you do want to monitor the site for inflammation and infection. You want to monitor the scab for signs of pus and inflammation and notify your healthcare provider of any symptoms caused by the injured site. All in all, if you do have any concern, you can always talk to your healthcare provider about your injury or specific illness. And when in doubt, please always contact your healthcare provider for any sickness, injury, or other bodily concern. Your life is important. Now, if you require additional information from the information that we presented here, or you want to do your own reading and catch up on some of the information, or just have some information on hand, we have these great resources for you from multiple accredited sites, and these resources will be presented on our website at Lung Cancer Initiative. Um, And as always, thank you for listening. And for more information, you can visit lungcancerinitiative.org and feel free to contact us for any questions that you may have. Thank you and have a great day.